Health Promotion Throughout the Lifespan by Shelby McKee, Haley Shambly, Amy Walker, and Megan Harrell. Among each group, there are different teaching points in health promotion, which can include but are not limited to nutrition, sleep and activity, dental health, immunizations, safety promotion and injury prevention, and anticipatory guidance. Health promotion during infancy. Nutrition and dental hygiene for infants. Breast milk and breastfeeding is the most desirable for infants during the first 6 months. An alternative would be formula feeding. During this time, unmodified whole cow's milk, low fat milk, skim milk, and other animal milks and imitation milk drinks are not acceptable. The number of feedings will increase. At 6 months of age, the amount of feedings decreases to 4 or 5. By 6 months of age, and the introduction of solid foods begin at 4 to 6 months of age. At 6 months of age, the GI tract has matured enough to handle more complex nutrients. However, allergenic foods such as peanuts should be introduced until at least 12 months of age. At 6 months of age, tooth eruption may begin, and proper oral hygiene is very important. Dental issues can be prevented by not allowing the child to take a bottle to bed. Sleep and activity during infancy. The total daily sleep needed for a 2-month-old is approximately 15 hours, whereas the amount of daily sleep needed for a 6 to 12-month-old is approximately 13 hours. Most infants are naturally active as well and don't need encouragement to engage in activity. Immunizations in the first 12 months of life. The infant should receive at least the first shot of Hep B, the first 4 shots in the DTaP series, HIV, rotavirus, PCV13, and influenza. In caring for patients of all ages, the nurse should be well educated about indications for delaying or withholding vaccinations. Other important factors that the nurse must consider is needle length, as the correct size needle can easily prevent an adverse reaction. Safety and injury prevention in infancy. 3 of the major causes of accidental death in infancy are suffocation, motor vehicle accidents, and drowning. A rear-facing car seat can prevent injury in the event of a car accident and should be used at least until they are 2 years of age. In the first 6 months, the primary teaching to the parents should be focused on motor vehicle, car seat safety, immunizations, proper nutrition, and establishing a schedule to both meet the needs of an infant as well as the needs for the parent. Health promotion for toddlers and preschoolers. Nutrition for toddlers and preschoolers. Toddlers need to have a more balanced diet of vegetables, fruits, and whole grains. However, the portions will tend to be smaller than that of older children. Due to this, toddlers usually require 3 meals and 2 snacks per day. Around 18 months of age, many toddlers begin to have decreased nutritional need with a decreased appetite. This phenomenon is known as a physiological anorexia. This may manifest as the toddler becoming an extremely picky eater with very specific taste preferences. Preschoolers will tend to follow the same preference style and picky habits as toddlers. The parenting concept of having the child stay at the table until the plate is clean should be avoided, as it can cause overeating in young children, which can lead to obesity. The goal of these age groups is to decrease fat and sodium intake and increase exercise to reduce obesity and cardiovascular disease. If a child is on a vegetarian diet, then vitamin and mineral supplementation will be necessary for adequate nutrition. Sleep and oral hygiene for toddlers and preschoolers. In the second year, total sleep decreases an average about 11 to 12 hours per day, with most children taking around 1 nap. Activity and exercise should be encouraged in these age groups, and rest periods between play and mealtime should be established. Sleep patterns of this age group can be improved by having an established bedtime routine. Poor oral hygiene and dietary habits are associated with dental caries in children. The most effective method of plaque removal is proper brushing and flossing. Toothpaste should be introduced at 2 years of age when the child is able to avoid swallowing the toothpaste. You should brush at least 2 times for 2 minutes a day. Safety teaching in toddlers and preschoolers. Small things around the house can be done by parents to ensure a safe environment. Examples of these include, but are not limited to, turning pot handles toward the back of the stove, ensuring all wall outlets are covered, safely store all sharp objects and all chemicals in a place far out of the child's reach. Use car seat safety and do not allow small children to ride freely in a vehicle without a car seat. Always closely supervise when around any type of water. Do not allow children to play in the curb or around vehicles. Teach stranger danger. Health promotion for the school-aged child. Nutrition and dental health for school-aged children. Likes and dislikes will follow the preschooler into the school-age years. Mass media, junk food, and the availability of fast food restaurants make it especially easy to fill up on empty calories. Nutrition education can include the USFDA MyPlate portion sizing. Dental health in these children. By the school age years, permanent teeth have begun to erupt as well, so dental hygiene and regular attention to dental caries is very important. Correct brushing habits and techniques should be taught. Regular dental supervision and fluoride supplementation are integral parts of the health maintenance program. It's also very important to have one dental provider. Sleep, rest, and activity for school-age children. School-age children no longer need naps. They average 11.5 hours of sleep for 5-year-olds and 9 hours of sleep for 12-year-olds. Children ages 6 to 7 tend to experience very few bedtime problems, and quiet activities, such as reading or coloring, can facilitate the task of going to bed. Middle childhood children 8 to 9 years old and 11 years old are often resistant to going to bed. However, children 12 years and older often go to bed without a problem. School-age children tend to have stronger muscles and greater speed and effort during motor activities. Over time, they acquire the coordination, timing, and concentration needed for adult activities, but they still lack the strength, stamina, and control. Appropriate activities for this age group include running, jumping, swimming, roller skating, and riding a bike. At this age, children enjoy competitions, but teachers and coaches must remember their age and physical limitations. Common sporting activities include baseball, soccer, gymnastics, and swimming. At this age, children also demonstrate increasing fine motor abilities and complex artistic skills. Sleep and health education. Part of the nurse's safety teaching should include the dangers of media. On average, children aged 8 to 10 will spend at least 8 hours a day with various forms of media such as tablets, video games, television, or computers. Parents need to monitor what TV shows, video games, and internet sites the children can access. Sex education is also an important teaching point for this age group, as the nurse should help differentiate sex and sexuality, provide education about the sexual information that they may find through the media. Child health maintenance is the parent's responsibility. However, the nurse in the school can emphasize comprehensive health practices. Health education is directed towards providing knowledge of health and influence habits, attitudes, and conduct in relation to health and injury prevention. Injury prevention in the school-aged child. Common injuries in this age group include motor vehicle accidents, burns, drowning, and poisoning. Motor vehicle accident education should include proper safety restraints, maintain discipline, and emphasizing safe pedestrian behavior. Drowning education should include teaching the child how to swim, teaching basic water safety, as well as teaching the parents basic CPR. Burn education should include making sure the home has proper smoke detectors, teaching safe cooking, and teaching proper behaviors in the event of a fire. Poisoning education should include teaching the child of the hazards of taking non-prescription and unknown medications. The nurse and parents should also educate about stranger danger, encouraging safe play, keeping firearms out of reach, and should stress eye, ear, or mouth protection. Health promotion in adolescence. Nutrition, dental health, and personal care. Adolescents have increased nutritional habits. There are specific dietary requirements for adolescents based on their activity level. Adolescents also have a substantial increase in the need for minerals such as calcium, iron, zinc, and vitamins. Dietary patterns that lack appropriate amount of minerals, vitamins, and overall bad diet could result in increased risk of obesity, chronic diseases, and cancers. In adolescence, eating habits are influenced more by peers, so education about eating disorders is extremely important. Dental care should take place at a minimum of once a year, but preferably every 6 months. Adolescence is usually a time of wearing braces, so the important care and appropriate toothbrushing technique for braces should be taught. Bodily changes associated with puberty bring special needs for hygiene. Frequent bathing or showering is necessary, as well as deodorant. Hair requires more frequent washing. Adolescent girls often have questions regarding hair removal, use of cosmetics, and menstrual hygiene. Health maintenance and activity. Scoliosis is a concern for this age group, more so in boys than in girls. Adolescents are the most active age group, and this age group spends more time and energy practicing and participating in sports activities than any other group. The Department of Health and Human Services recommends a minimum of 60 minutes of moderate to vigorous physical health daily, along with muscle strength activity 3 days a week. Practice of sports, games, and dancing contributes significantly to growth and development, education, and better health. Hypertension and hyperlipidemia are health concerns for this age group. A universal lipid screening is recommended for children between 9 to 11 and is also recommended again between 17 and 21. Immunizations for this age include Tdap if they are 11 to 18 and have not had a booster. Meningococcal is given at 11 to 12 years of age with a booster dose at 16. HPV, as known as Gardasil, Hep B, if they haven't already had this series, yearly influenza vaccine, and varicella if they have no prior history of the vaccine or the disease. Emotional health and expression. Adolescents fluctuate their maturity levels between considerable maturity and childlike behavior. One minute they may be energetic and enthusiastic, and the next they may be quiet and withdrawn. As a nurse, you can encourage appropriate strategies to cope with stress. Body art, such as piercing and tattoos, are typically seen as a form of self expression. The risky behavior can sometimes cause infection, cyst, or keloid formation, bleeding, dermatitis, or metal allergy. Artificial methods of tanning, such as tanning beds, have also become popular among adolescents. The use of these can place adolescents at an increased risk for development of skin cancer, and the risk of this behavior should be explained to the adolescent. Safety and injury prevention. Injuries are the most common cause of death among adolescents. Unintentional injuries account for more than 48% of deaths among teenagers from 12 to 19 years of age. Motor vehicle injuries are the single highest source of unintentional injury in adolescents. Safe driving practices should be taught and include safety belt use, driving the proper speed, not driving under the influence, and proper behavior as a passenger in a vehicle. Homicide is the highest source of unintentional death in adolescents. Education about the safe of proper use of firearms should be emphasized. Parents should be educated about keeping guns in a local location that is not accessible by their adolescent children. Ammunition should also be stored in a separate location from the guns.